So, good morning, guys. Hope you're all doing great. Today, I wanted to talk about my gallbladder experience, my surgery and all those symptoms and all. So, it first started in November 2017, and in the middle of the night around 11:30, I got a very bad pain at the center of my chest, and it was so bad. It was so bad. It was just like cramping at the center of my chest, and I didn't know what to do, and it went all over till 6 a.m. in the morning, and my mother was giving me all the gastric tablets and all that. Um, it just used to suppress for some time, and again it used to shoot up. So I didn't have an option. At 6 a.m. we had to run to the emergency ward, and I had to put this spandy drips. So that is how it got reduced. And they checked, they made all those scans, and what they came to know is that I had gallstones. And the doctors actually told me that they would you know immediately do the surgery on the bed itself. But my husband was out of station, and my mom didn't wanted to um, do or accept anything without his consent. So she said we will wait for her husband to come. But then I got discharged, and I was eating calm foods like milk rice and curd rice and all that. And this kind of pain used to happen frequently. I have no idea. So basically, I used to cut off oil from my diet, sugar from my diet, and any fat from my diet like cheese and butter and all that. Homemade ghee I used to have. So deep fried and all those kind of foods that I had to get rid of my diet. And actually, I did lose a good amount of weight. I was actually 103 kgs, but now I have come back to 98 kgs. So as I reduced my weight, it was good. But again, some or the other thing, I have no idea. The pain actually starts around like 11:30, 12, and it goes all the way till 6. I have no idea what is that timing of that, frankly. Yeah, then that's how it happened. So it started in November 2017, I said. So almost an year I pushed it. I was doing yoga. I didn't wanted to go through a surgery, even if it was laparoscopy. I was so terrified because from my childhood, I have never even gone to the hospital, even for tablet or anything. I was so healthy, and suddenly all these things started. You definitely get that phobia of that office. That's a freak. You get scared of that office environment. So I just pushed it to November 2017 with lot of these attacks during the night. At least 5 or 6 times I had in 1 year of span. Then what happened? Yes, as the months went, um, one fine like 1 week almost, the frequency started increasing a lot. In a week, I think I got twice or thrice an attack. So that was when we went to the doctor, and they said, it is not good to delay. It is better to remove it, because don't want other complications to happen, because as you know, pancreas and liver and all are there itself. So they were like, even I had read so many articles that sometimes your gallbladder bursts open and all those things if you just leave it like that. So I just went to the checkup today, and tomorrow they gave me an appointment for the surgery and all that. So again, fasting for some that night and morning 7 a.m. to some 9:30, 10, I think. I'm not sure, like I was in anesthesia. So it was March 16th, 2018, no, 2019 that I got my surgery done. So almost November to December, December to Jan to Feb to March. So it's almost 1 year, 4 months I was suffering with this gallbladder symptoms. And to tell you, it is the worst. Okay? It is the worst symptoms, that kind of pain. It's like, in the night, the episodes I'll tell, once the pain starts, you start burping so loudly and so frequently, so many times. and with the pain starts hurting at the center of your chest, and plus like you may have loose motions once or twice for sure, and you'll have sessions of vomiting, just vomiting water or whatever you have eaten that night. You just vomit like 4 times, 5 times during that night period. So these were basically the whatever the gallbladder that was my cat. The gallbladder, that pain is too bad. And by the time like 6 a.m. in the morning, once I got all those pandy drips, because without the pandy drips it used to not reduce for sure. Like how if I used to take pandy tablets or Next Pro and all that also, it used to not reduce. It was so severe that I had to go in the morning to the emergency ward and take a drips of pandy, and then it used to reduce and I used to fall asleep. I was so freaking tired after all that episode in the night, and I was like, oh my god. And always a fear of eating something. I don't know, I used to always have a fear of eating something. Oh my god, if I eat this, what would happen? If I eat that, what would happen? And I will tell you, post operation, that is March 16th, yeah, in 21 days I was able to walk normally, but still, those anesthesia effects will be there. You are so weak, you're so like, leave me alone. And the trauma of going through a surgery first time in your life, especially to a person of me that, as I said, I used to never even visit the doctors during my childhood or any time before November 2017. It is shocking, but I have not been taken to the hospital for fever or any sort. I had no health issues at all. I was perfectly fine. I can remember hardly I had once or twice visit to the doctor entire lifetime. I was a very healthy baby, and for someone like that, I had to just, prick IV here and here if this didn't work. And oh my god, the trauma is like, I cannot even explain. Yeah, so that's what happened, and it frankly took me 6 solid months to come back to normal, at least. Like, normal means in immunity level, in little stamina level, for my system to get adjusted to the new no organ body. It was like 6 months. Again, the 6 months trauma was disgusting to be telling. I guess I think, yeah, maybe slowly I started eating food, but some foods which I used to have, again, I used to have the episodes of vomiting and pain and all that. So I think 3 episodes after that, and the second one was really worst. I don't know, it was food poisoning or something. Once, like some food poisoning I had in the evening. I had some chaats of bel puri in some hotel, and it was like, oh my god, I cannot even explain. I just came, and that night, yeah, it was some A to B hotel somewhere in Ahmedabad. I don't know, I'm not sure. Yeah, so yeah, on the way to Hepat or something, I had some chats, and I started feeling this discomfort in my stomach in late evening. And that night, my husband had booked a movie for us. So went to the movie theater. It started hurting. I used to not tell him because it was so frequent. All these things that you feel like your loved ones, how much you can also tell them and they get distressed. It was a movie night, so how much you would try to distress other people around you. So I used to just excuse myself and go to the washroom and just vomit profusely in the sink. I got up at least 5 times in the middle to go and vomit, and it was so bad. Like, we had to get up in the middle of the movie and go to the doctor, and they had to give me an injection to stop me vomiting. And on the way there also, once or twice out of the car door, I used to vomit. And while going into the hospital also, it was so painful. I had to just sit down, like almost crisscross. I used to just lean down and vomit there only in front of the hospital. So once the injection fell, and I was like, okay, and I was so tired and I slept. So that 6 months of recovery was also worst, and there were other things that followed. The thing I got down. See, what I think is that after a surgery, let it be a laparoscopic or a manual surgery, or any surgery for that matter, your body becomes weak. If you are mentally, yes, it mentally affects you, physically affects you, the anesthesia affects first time in your life and all that. And for my body to adjust to the new food habits without an organ was also taking time. That was 6 months. And during the 6 months, as I said, I came back, that is when my sciatic nerve got worst, frankly to say. Yeah, I don't know for what reason. I had sciatic pain before that, but that was when it got worst in that 6 months. I don't know. As I said, the immunity level falls down, so I fell sick. I had a very bad viral fever. So I came to know after the viral fever is that I cannot take antibiotic tablets for the rest of my life. Even if I get a fever tomorrow or something, I'm not sure in future, I have to take antibiotic IV. Okay, I cannot take tablets. So that fever, when I used to take crocin and all that, it didn't reduce. So my husband, my mom went to the doctor and they gave prescribed antibiotics. And once I started antibiotics, yes, the fever reduced, but that again started the gastric. The same thing started again. I started like just vomiting. Whatever I used to eat, I used to like vomit. I had basically a small bowl with me, so that I used to just sit there. I was so tired to even go to the bathroom. So it was just sometimes more of the time vomiting sensation than vomit. But whatever I used to have, it was like vomit. And I'm sorry to use the word vomit, I'll just use. Okay, so then they took me to the hospital. They got me admitted. Again, they gave me a drips of Pandy, and then it reduced. The fever reduced, the vomiting reduced, everything. It was hell of an incident. So then I got discharged after 2 days, and following the fever was joint pains. I don't know what kind of fever was that. This used to pain, all the joints. Basically, this is my leg, you think, okay? So this used to pain so badly. So after the fever, that was a different episode, okay? So this is what so that is what it followed. So 6 months, that is March 16th to September 16th, which was September 15th is my birthday. So it's almost 6 months that I came to know that I have improved finally after 6 months. So basically my body took about 6 months to completely heal, and in between that, with the gastric effects and vomit and all that, I had other issues that I do not want to tell it, because this video is only about gallbladder things. So basically other health issues was all about lack of stamina, lack of immunity, and lack of the organ in your body. So many things happened. It was just a laparoscopy, to be specific, but still, see how much a human body goes through. So now also I am not able to eat something like greasy food like a pizza or a burger. I've cut off all that from my diet, and I don't have coke and all. So I'm just sticking to normal Indian food. Sometimes if I want to eat something out, I'm very specific. It's not too oily, too spicy, too greasy. I cannot eat all those. So I always have a strip of Pandy with me. See, I don't know how many Pandys I've eaten in my life. I don't know how to show. It's showing in mirror image. So I have done that. So basically this was my gallbladder story, and still now, there is nothing like free of eating food. Still, it was not as worst fear and all that as before the surgery, but right now also, if I want to have some vada, something deep fried, I make it at home. I avoid eating outside. No, I do not eat, because I'm scared. Who knows? because your system is so delicate. Why do you want to try some oil which is outside your home? And sorry guys if I've used the word vomit, because uh, that is how it was. By hearing only it is irritating, means physically vomiting is worst. So that is the reason those many episodes of vomiting I had. So that is the reason I use the word vomit so much. So if you people got irritated, I'm really sorry about that. Just talking out my experience to you guys. So what I would suggest is that if anyone has a gallbladder issue, please don't hesitate, please don't suffer like what I did by delaying it almost 1 year, 4 months. Please go and have your surgery done. It is a laparoscopic surgery, so it takes at least a week to get, at least a week. Not at least, I meant, to just start walking. They may say the next day only you start walking, not like that. It takes at least a week and 15-20 days for you to be just like normal, at least not normal, but at least okay. But trust me, it takes 6 months for your body to adjust to the no organ routine or system in your body. So that is the thing, guys. So just I hope I gave an insight about the gallbladder, how it is, how gallbladder symptoms that attack. Yeah, the surgery that I went through was cholecystectomy. I don't know, I'm sorry if I pronounced it. I'll just put it right here. Okay guys, so thank you so much for sitting and hearing me with patience. I appreciate all of you, the time that you invest in seeing my videos. So and I hope this video has given some insight of something new that would help you, or you whatever. Okay, so thank you. So bye guys, take care, love you.